Our new series, Medical Price Roulette. We've teamed up with Clear Health Costs to see why Americans are paying dramatically different prices for the same medical procedures. Today, investigative consumer correspondent Anna Werner focuses on how insurance companies and providers keep some charges a secret. Anna, what did you find?
Right, we're going to talk about this through the lens of one young woman who learned the hard truths about the healthcare system when she was just a teenager.
I am 15 years old. I know that's not that old, but at least I should have some say in what I want being done to me.
That was Morgan Gleason 5 years ago, already speaking out about health care.
I am the patient and I need to be heard. And these are all my morning pills.
Now 21, she's learned a lot about the system through her own journey. Gleason suffers from a disease called juvenile dermatomyositis, which causes severe muscle weakness. Treatment requires expensive infusion therapy once a month in a hospital.
If you couldn't get those, what would that mean for you?
I mean, not to sound morbid or anything, but I could die.
But as a budding health activist, it was the payments for those monthly infusions that caught her attention.
It was mind-blowing to me. It was just shocking.
Shocking because she discovered insurance companies paid different amounts for the same procedure. Gleason is covered under her parents' insurance, which over a year changed 3 times. For each infusion, the hospital billed roughly the same amount, around $29,000. In June 2018, records show Cigna paid a negotiated rate of just over $3,300 for that procedure. Then in December 2018, Blue Cross Blue Shield Alabama paid a different negotiated rate, just over $3,800. Yet in February this year, insurance company GEHA paid 5 times as much, nearly $21,000.
It was $17,000 more.
$17,000 more was this bill.
I was like, how is this even possible? Like, the only thing that's changed has been what insurance I have.
That difference affected the cost to her parents, too. Gleason says the price they paid went from about $220 out of pocket to more than $4,000 under the different insurance plans for the same procedure at the same hospital.
There's no rhyme or reason to it.
Doctor and health services researcher Aaron Carroll says it's all about the price negotiations between hospitals and insurance companies. Deals, he says, are done in secret.
They don't want everyone to know the information.
Because why not?
Well, because if everyone knows the price, then everybody can say, I want that price. Not letting everybody else know someone else is getting a discount is a good way to get some people to pay more money.
Ashley Thompson is with the American Hospital Association.
Why don't hospitals make it public what those deals actually are with the insurance companies?
Hospitals don't expose privately negotiated rates. It's a competitive market, it's a private market, and both hospitals and insurers believe it should remain that way.
But if it was public, if consumers knew those prices and could understand them better, wouldn't that help?
Again, I mean, I think that what consumers really want to know is what they're going to pay out of pocket.
But even figuring that out can be a real challenge, as New Jersey's Beth Toffel knows. 3 years ago, she wound up paying $4,000 for cardiac tests after insurance.
It's a lot of money, and it's a lot of money when you're already spending money on insurance.
She needs those tests again, but this time she's calling around to check prices and let us listen in.
Can you tell me what they would run this time?
They told her they didn't know the price. She would have to speak to the lab. So
I'm trying to find out approximately what tests will run.
The lab told her to call the financial counselor.
Hi, Gladys. This is Beth Toffel calling.
It went to voicemail. 2 hours later, she was no closer to an answer than when she started.
I think that's what happens. I think people either probably give up, they don't understand half of what they were told, and maybe they don't get the care they need.
Well, Toffel's still working on getting those tests. We reached out to the insurance companies in this story. Only Cigna responded, saying it empathizes with Gleason's situation, but said it's important for people to realize that health care costs vary. And they're right. So to share the prices, the varying prices you've paid, go to cbsnews.com/health costs. You can also see what others paid in our sample cities. Share your prices with us, folks.
The subtitle of this series is Anna Makes Us Angry. It makes your blood boil. Yeah. And to hear the hospitals say, we don't want you to have this information.
Yeah, well, you know, they're saying, look, it's a private market. market and they think it works a certain way, and that they actually say that the insurance companies say that if you expose the prices, they think the prices will go up.
Yeah.
That's what the insurance industry's position.
Well,
people want to know the end cost.
There's transparency in almost every other industry now. There needs to be transparency in this one.
Go to cbsnews.com.
Well, it's never good in an interview when the person goes, again, da-da-da-da-da. What you're saying is, again, I heard you, but I don't understand what you're saying.
Yeah, I'm trying to understand why exposing prices will make things worse.
Especially when you're dealing with bills that basically can bankrupt people.
Thank you, Anna.
Anna, thank you very much.